All right, guys, welcome to the podcast, Ancient Wisdom, Modern Science, and Common Sense. That's the title for this series. And we want to get into a lot of topics that have to do with anything health related, whether it's emotional, chemical, physical. We're going to break all that down. And today we're going to go into lower back pain. Lower back pain is, they're saying, the second most common form of disability in the United States. So you can imagine what a nuisance that is, from the workplace, people missing work, to their inability to exercise and be with their children. It's a big, big problem. And as you can see by the multiple disciplines that are dedicated to it, from chiropractors, physical therapists, acupuncturists, personal trainers, the surgeons, there's so many disciplines that even dietitians, right? Anybody that's trying to take the weight off of somebody, because that's also a factor in lower back pain. So with all these professions trying to get this thing handled, I just want to touch on some of the basics today, because any small portion of a lecture or a topic on lower back pain can go on for days. There's research you can't even imagine from every aspect of it. But when we look at disability in this country, I was looking up a couple of things. The number one cause of death in this country right now is heart disease. But the number one cause of disability is arthritis, which is some of the reason people have back pain. But number two is back pain, right? So let's start out by looking at how we look at a lot of topics, or how I go through a lot of topics. I look at the emotional aspects of an issue when someone comes in to see me, the chemical and the physical. So what are the emotions this person may be experiencing, either in a high amount or over a long period of time? What are some of the chemical changes that the body might be going through, from reactions to food, allergies, maybe water intake isn't proper, that kind of thing, mineral deficiencies. And then, of course, the physical traumas that they might be going through, repetitive postures, and of course, injuries. All of this adds up, and sometimes it's a myriad of all three of those areas, like any condition. But we're going to answer some questions today as well. But I want everyone to realize that when you're trying to figure out where low back pain is coming from, study each of those areas, right? Take a good look at your work environment, your play environment, what you spend time doing. What is your body posture? Let's start with that. Are your legs in the same place? I have people that sit on one leg or prop one leg up on a desk, or chronically cross their legs. And that creates a torque in the spine. And if you look at how the spine's put together, it's put together by bones that are fit into each other like puzzle pieces. They're shrink wrapped, I say, in ligament. Ligament attaches bone to bone. And there are banded ligaments, and then there's ligament that almost wraps around bones. And the ligaments in the spine are both that way, but mainly they're wraps. And the disc between each of those vertebrae is a shock absorber. So that's the secondary stabilizer, bone being first, ligament, shrink wrap being second. And the third is muscle. And muscle goes into kind of two categories in the spine. Sort of fast and slow twitch, or postural and non-postural. And what that means is some muscle can sustain a contraction for a long period of time, but it can't turn on and off fast. You think of a sloth bear. They can hold a posture in a tree with contraction, but it's not fast at moving. Unlike a cheetah probably wouldn't be very good at yoga, but can move really fast, right? So they have fast twitch muscle. Our spines are given this blessing of having both. But if we don't tonify those or use those properly, they get weak, and there's a problem, right? So, and when it's a mechanical or a physical issue, we want to say, is it bone? And obviously that's very hard to fix. Some people are born with anomalies in their spine. That's pretty rare though. But the discs, disc herniation, slip disc is more of a slang term for that, or bulge disc, or strains to the ligament. Just like you can sprain an ankle, you can sprain a back. And a sprain implies that the ligaments have gone beyond their elastic barrier. So if like you take a rubber band, you pull it till it stops and you let it go, that's fine. You pull it till it stops and hold it for 6 days. You let go of it, it never really goes back, right? It's been destroyed. And if you pull it beyond the elastic barriers, it can tear, of course. And in the spine, that's an avulsion, like an avulsion fracture. Sometimes a piece of bone actually pulls out where the ligament was attached. Those are severe injuries. Most people are not dealing with those. Most people's back pain, when you're looking at the physical aspect of it, is coming from improper posture and, of course, injuries, right? We all know that we lift heavy things, do things a little crazy in the gym. But the sneakier stuff, the stuff that people can't figure out why, sort of falls into two categories, the chronic posture or the improper use over time, right? So in other words, we can do something we refer to as a micro trauma. So a small traumatic event occurring over and over again. You think of somebody in their job who pulls a lever or does a particular task. Over time, that repetition starts to wear down, and breakdown exceeds repair. Okay, so when we look at the physical causes, it goes into those categories. If we go into the chemical causes, it becomes a little more vast and interesting, because we can start with water. That's pretty simple. Our discs are hydrated structures. They're sponges or shock absorbers. And when they're filled with water, they act like a better shock absorber. Imagine a wet sponge, how nice that is to absorb shock versus a dry sponge. And if you leave that sponge dry, it actually degenerates because it doesn't have the nutrients flowing in and out. Water is part of our circulatory system. It's obviously a good portion of what our blood is made up is water. And the runoff from that gets into our disc to feed it has nutrients that need to keep the disc alive. A lot of degeneration comes from simple dehydration, as well as physical abuses. But when we're looking at the chemical side, inflammation, that's the buzzword today. We can't get through a podcast without talking about inflammation. And that means that something is causing an irritation to your body. A lot of times that is simply a food that you're not digesting properly, or you have an intolerance to. A lot of dairy products. I don't really believe the dairy products are necessary for humans. So when we ingest things like that, we tend to swell a little bit. I think it's 80% of the population is lactose intolerant to some degree. And that should be a hint that, this milk, dairy, cheese, these kind of things are of very little value and probably a detriment, in my opinion. So any food that you're eating that you're not breaking down, whether you're under a stress while you eat it as well, that can cause, a problem with the ability to get it to its small parts. And if food gets into your bloodstream as non-self, meaning big chunks instead of little tiny things, most of us understand that a protein is made from small little amino acids, and our digestion is taking that protein and breaking it down to amino acids, and then that gets into the blood. If you get a protein in your blood, then your body may attack it as non-self. It may think it's a virus or a bacteria. And in that case, that comes with some inflammation. And then that could actually crystallize in your blood. There's a arthritic condition called gout where that happens. We don't break our purines down, and we end up with a uric acid crystal. And that leads to not only pain, but also arthritic degeneration over time. So when someone discovered that, they discovered that there's probably other pathways where food turns into crystals or turns into something that doesn't belong in our bloodstream, and certainly not in our joints. So leads to a breakdown, right? So the chemical answers are: how are we eating? The speed at which we eat. We talked about that in other lectures as well, where if you eat a food too fast, you don't get the luxury of the enzymes, from your salivary enzymes to pancreas, breaking that food down to small parts and getting into the bloodstream and able to rebuild our body, which is basically why we eat. So we want to make sure that we eat slowly and we chew a lot, and we're in a mental state where food can be broken down. Stress and high emotions, dinner time with a lot of strange conversation or stressful conversations can lead to a inability to recognize food and break and put the right enzymes out to break it down. And we end up with, back pain, knee pain, any joint problems can occur, sinus congestion as well, from the chemical side. Now, when we look at the emotional side, it becomes really wild, right? Because when I researched this years ago, I realized that there were certain people would come in my office, and by getting to know them a little bit, I could almost guess where their pain was, whether it was in their neck, their middle back, or their low back. And it had to do with what emotion I think they spend the most time in. Some people are kind of anger-based, other people are fear-based, other people are in a lot of a disgust mode. So to oversimplify to start off, the neck and shoulders are fear, the middle back is disgust, and the low back is anger. What that means is we're turning that stuff on. From an evolutionary standpoint, we light those things up to try to solve issues. Like fear would be the guarding of the vessels in the neck. Very important if you look at how predators take out their prey. Disgust is the one to get something out of you, right? So it's like throwing up. It's using the middle back neurology or muscular, and it increases the tone there. Anger is charging at or attack, and that's the lower back. But we can add another layer on that and look at, if we stick with lower back, that area is related to the organs that get the nerve supply from those vertebrae. right to those organs. Any of those organs being overused or having trauma, you think of sexual abuse, is very, very commonly manifested as lower back pain. And people need to heal that, of course, to get their back pain completely diminished. But they might not know that, or they might not be able to do that without proper counseling or spiritual development of some type. So I encourage that for anybody that's been through something horrible like that, is to realize that that could be adding to or the sole cause of your lower back pain. If you look at some of the different exact emotions, I made a list: anger, survival issues, depression, self-doubt, lack of emotional or financial support, sexual issues, like I just mentioned, from dysfunction, sexual dysfunction, to rape, to sexual abuse, being criticized in an excessive way, rejection by your peers, and or self-rejection. Those are some of the biggest emotions. And if you think about, if you have a pet, especially a dog, and you're in a situation where it does something terrible and you yell at your dog, they get into a shame posture. And if you look, the tail goes between the legs, they sort of hunch under, and my dog would like crawl on the rug really low when you did something wrong. Sometimes you didn't even say anything. You just walk in the house, he's crawling around 2 inches off the rug. And you realize, well, we're going to find something in the house that isn't going so well. But that is something that we do subtly. It may be noticeable. As chiropractors, we tend to really notice posture. And I've read so much about posture and the mental state that I can sort of read people when I meet them by their posture over what their confidence is, what some of their damage is, what are they protecting. And then, it's not just stillness, it's the way they move too. The ease at which they move has a lot to do with what they're protecting, not just what hurts and what doesn't move, like in arthritis in older people, but in people that are holding on to an area that's been damaged. Either it's been abused and damaged, or it's just plain damaged, which sometimes is both. So those are all, I think, crucial and important things to know, that we have in review, a chemical issue potentially for lower back pain. We have a postural and or physical answer, and we have an emotional answer. So always investigate all of those anytime you're about to go and spend some time trying to figure out why your back hurts. And always seek professional help. I mean, as a chiropractor, I have an incredible respect for this profession, as well as other professions that are related to it. I don't find drugs to be the long-term answer. Of course, in the short term, when pain is unbearable, these are things we do. And sometimes that's all that's left, because the back is so degenerated that you're going to spend maybe the rest of your life on some pain medication. But still, it doesn't mean that you just surrender to that. I have patients with severe back trouble, and if they come to me, I can cut their pain meds in half. They can go to their doctor and say, "Hey, I'm feeling really good. I'm gonna see if I can get off of this one and get off this one." And between their medical doctor, myself, and them, we can make great decisions on minimizing the drugs that they're taking, because their liver, their kidneys, their stomach, and brain, the entire body, pays a price when you're putting pharmaceuticals in your body long term. So if we can do that and make less of that, that's great. When people surrender to back pain and use medication only, and don't look to the professions, whether that be personal trainer, an acupuncturist, a chiropractor, it's sad, right? Because you've just given up, and that isn't the way to go, right? I encourage everybody to keep fighting to look for answers, because sometimes it's a different chiropractic technique, sometimes it's a different part of the muscular system that needs to be addressed, because there's a lot of postural or muscular imbalances that lead to back pain. Physical therapists tend to be really good at that. I'm pretty good at that because of all the weight training and exercise I've done in my life. And it's also part of any chiropractor's training, is to look at how the muscles what are the muscles doing that may not be so good, right? And probably an overall topic that is in the physical range that I don't want to leave out is aging. Aging is going to happen. We're going to get wrinkles on our skin. There are certain things that are unavoidable. But if you look at, people look different at different ages. Some people look 20 years younger than they should be, and some of that's genetic. But more of it is the life they've led. What have they done to the body, So when we're looking at age, what we're looking at is weakness and rigidity, right? Two things that happen as we age is we're going to get weaker and we're going to get stiffer unless we do something about it, right? So a lot of my patients, as they reach their 40s and 50s and above, are suffering that, and they don't know what it is. They're like, I moved subtly and I have this terrible back pain. Back pain that comes out of nowhere is usually from a slow progressive weakness and hardening of the body. So the body no longer has that spongy ease to it. That's why I promote yoga so much. Yoga is a strengthening and stretching activity. You're able to do two things at once. I mean, how great is that? You talk about time consumption. People say they don't have time for stuff, time for their workouts, time for this, time for stretching. Yoga does both at the same time. And just like I like to demystify meditation, I'd love to spend time demystifying yoga, because there is a yoga for you. There's so many different forms, and there's so many different levels at which you can go with it. It can be very intimidating to see some of the postures people can hold, especially women versus men. Women have so much more elastin in their ligaments. They're just born to be more flexible. And I would not want to be comparing myself to the average woman in the yoga class. It's kind of shameful to see what you'd have to go through to keep up. It's painful. So what I want to be able to get across, though, is as we age, we want to work on our flexibility and we want to work on our strength. And if we're doing those two things, we're really slowing the aging process of the frame, because you can lay on the couch till you're 25 and look beautiful and be strong, and because you're basically just basking in hormones that build the body. I certainly don't recommend that, right? But a lot of people are just, doing so-so workouts and doing this, and they look fantastic. And then your late 20s and 30s and 40s hit, and all of a sudden you start to look, in a different way. And that look, that's fine if you don't mind looking that way, but you're going to pay for that, right? It's going to be painful at some point, because the body, when it looks a certain way, functions a certain way, form and function, right? When you see somebody strong and with good posture and the right weight, you get the idea that they're probably put together better and probably suffer less pain than somebody who has, kind of all rounded off and, hasn't really done what they should to maintain a stronger body. But so that's pretty much the introduction to this. Low back pain comes from emotional, chemical, and structural areas. We should investigate all those. And, we should get to some questions now. We looked up popular questions. A lot of the questions have been asked of me daily, sometimes 10 times a day, same kind of question. And I want to address some of that. One of the things people, come to me for is they want to know, is my back pain serious? And that's a fantastic question. It's really, really a good idea to know the answer to that one, if nothing else. It's probably I started with that one because it's the most concerning for me. As a doctor, I want to make sure I diagnose everybody properly. So my question in my head, whether the person's asking or not when they first come in, is, what am I looking at? What kind of conditions am I dealing with? And that's why we take a long history when someone comes to us. Any doctor takes a involved history focusing on, the cause of the condition. Now, lower back pain can be dull and subtle and deadly, right? You could be having, believe it or not, a tumor growing in your spine. That's deadly. That is a dull ache. It's not even a big deal. It will become a big deal from a pain standpoint, most likely. It still doesn't have to be. So how do we know when someone comes in with dull aches that it's not something horrible? Well, you take a history. So what is the family history? So look at the gene pool. What has the person done to create the back pain? Now, that isn't a great question, a perfect question, I should say, because I've had people twist and have back pain and think, well, it's because I twisted. Well, what really happened is they shattered a vertebra with a bone tumor in it. And, the twist was something, but the twist wouldn't have caused that back pain without a serious health condition underlying. So we take x-rays and we send out for blood work oftentimes. Now, as a chiropractor, a lot of that isn't covered. So we send people to primary, and we got to do the dance because we live in New York State, where our scope of practice is a little limited. We can't do all the stuff that other chiropractors can do in other states. So we work with that, though. We put everything together that we can. An involved history and then a good examination. And usually by that point, you pretty much know what you're dealing with. And so when is it serious? If I'm going to answer that a little in a short way, when anything else is going on that's unexplained. Weight loss, of course, right? Weight loss. Unusual fatigue. The pain is worsening slowly over months. That's the growth rate of a lot of cancers, is slow and over time. So a dull roar turns into a slightly bigger one and a slightly bigger one over a 6-week to 3-week period. The more severe pains oftentimes are more innocent things. Not always, of course. We're dealing with the human body here. But a lot of times, a disc herniation is ungodly painful. But in the world of life-threatening diseases, it's not even on the list. Outside of the inability to get out of a burning building because your back hurts too much, you're not going to die from disc herniations. That's, just way outside the norm. But they're terribly painful, and we work on them in multiple ways. Sometimes they end up in surgery if they're big enough, if they're causing nerve pressure. Other times we just work with them in a matter of 6 weeks to a couple of months. We can calm these things down. But when we're looking at serious back issues, we want to make sure that the other thing we're addressing is any other areas of the body that aren't performing properly. Nerve pressure is one of those. So weakness in a leg, numbness, tingling, strange sensations go wrapping around the body. Those can be simple nerve pressures, but they could also be nerve dysfunctions of some type. I've had brain tumors in my office where a person had numbness in their leg, and they also had low back pain. Now, the low back pain was good old-fashioned low back pain. The numbness in the leg was coming from a brain tumor. So how did I figure that out? Well, we asked a lot of questions and got some great answers about the person's visual field and some other numbness and tingling episodes they had, and the history of that individual, as well as their genome. So back pain is serious when other things are going on that are unexplained. But that is usually if you're concerned that your back pain is serious, see a professional. Come into a doctor, get an X-ray, get blood work done, get a good exam, talk to somebody with experience, professional with experience with a degree, not just your neighbor, and get a good answer for that. So I hope I answered that properly, because it's a great one to know whether it's something you should be dancing around with or getting immediate help. Of course, fevers as well. I didn't put that in the list, but that's obviously, you could have bone infections, all kinds of meningitis, things like that. So another great question is it muscle or disc? That came up. Well, people say, is it muscle or bone? And muscles tend not to be singularly a problem, right? If someone has a mineral deficiency, say magnesium, for example, you'll have a lot of muscle spasms. They can be in the back. They tend to be more in the legs. But magnesium is a common deficiency. We run through it very quickly. It's not in that many foods. If we eat real healthy, it is, of course. And that might not even do it sometimes because of how our food is grown, the soil it's grown in, organic, non-organic, genetically modified. Who knows what mineral content's in that food. So we want to make sure that we separate out the fact that muscle tends not to be a big problem. If you look at why people are in wheelchairs, how many people do you know have muscular problems that are debilitating? I'm sure you know a few, but that is less common. You want to know why people are in wheelchairs? Almost always disc herniations, nerve problems, from Parkinson's to nerve diseases and bone diseases, not muscle. Muscle's really, really recuperative, but there are muscle conditions. Okay, so feel free to comment on that. But I'm not saying they don't exist. I'm just saying they're so much less common to start off with. So when someone comes in and says, I think I just pulled a muscle in my back, well, the question is, okay, that muscle's pulled. How did it get pulled? Well, muscles hook up to multiple vertebrae. The same muscle will go over and span multiple vertebrae, and each vertebra has 3 joints on it. So any of those 3 joints and any of those multiple vertebrae, if they stick and bind instead of move properly, they can tear the muscle simply through being like a rusty hinge. So is that a muscle or a back problem or a muscle or a bone problem? It's both. But what's primary? You can't just keep healing the muscle. You got to get to the cause. And the cause is a restricted, out of position vertebra very often. And so when it's disc, to separate disc from bones, misalignment and ligaments, you usually get a pain that tends to be severe. It tends to cause nerve pressure. So a person with numbness or tingling running down their leg, that falls into a more serious back condition, and you have to differentiate that from other, tumors, masses, and such. But so commonly, when someone herniates a disc, there's a certain age group. It tends to be in your 40s. There are herniations in young people. They're really rare, and there's not that many in older people because the disc degenerates, dries up, and doesn't have the gel in the center as much as it used to be able to herniate out. Because herniation is the central gel in the disc between each vertebra squeezing through the outer fibers. I always tell everybody a disc is sort of like a roll of tape with a super ball in the middle. and the superball sits a little higher than the roll of tape on the top and bottom, and the next vertebra rocks over the top of that ball, but the tape is sort of adhered to the bones above and below. And if you pound that, squeeze that down, that gel is going to go somewhere. It tends not to go in through the bone, although it can, but it usually goes right out a certain path that used to be an old artery when from we were embryos, and herniates out. We had Dr. Clary on the show. He's a power lifter, as he's told us. He has multiple disc herniations and a couple of back surgeries. He's, in love with his sport, and he's paid a price for it, but it's something he loves to do. And he's herniated discs from the sheer pressure of lifting over 800 pounds in deadlifts and all the wild stuff that he does. It can happen from, one big load, or it can happen from multiple pounding, like in football players, and tend to herniate discs a lot as well, from ramming into each other and consistently pounding. The gel works its way out as well. So back pain tends not to be muscular primarily. The muscles can hurt, but the primary thing is improper positioning, improper motion of vertebra, leading to the muscles having to overwork or get caught off guard by a movement that was restricted. So that's the best way to answer that. Is discs tend to shoot pain down, muscle tends to be more focal, lower back pain tends to be really bone-related lower back pain, vertebral misalignment related back pain tends to be really focal. You can put your thumb on it, unless, of course, that disc is herniated and then touches the nerve. So another question came up, how should I sleep if I have low back pain? I think that's a great question. I am not someone who ever recommends belly sleeping. There are people that can avoid it. It's how they feel comfortable. I want people to side sleep or sleep on their back. And side sleeping, if you are a side sleeper and you have a favorite side, and most people do, you want to make sure you're sleeping with a body pillow. Why these aren't more popular is beyond me. They're so comfortable. I sleep with a body pillow. And what it means is it's simply tube-shaped pillow that goes from your ankles up to your chin. And you put one arm on it, you put one leg on it, the one that's up. So if I'm laying left side down, I'm going to have my right arm and my right leg on the pillow. And what that does is it lines your spine up. Try it sometime. If you're laying in bed and you lay on your side, left side down, your right leg is going to sort of go past the right one. The right one's going to go past the left one, and you're going to get a rotation in your spine. And staying rotated all night like that can lead to back trouble because you're squeezing the vertebra. You want your joints in a very neutral position while you sleep. You don't want them at any of the end plays. You don't want them all the way to one side or all the way to the other side. And a body pillow puts you in that very neutral position. It also works for people with shoulder problems. I've messed up my left shoulder a bunch of times, and I'm a left side sleeper. When I put a body pillow in, the weight of my arm, my right arm, isn't driven into my left shoulder. It's on the pillow in front of me and driven into the bed instead of my shoulder. So it takes so much weight off my shoulder. It feels great. I can sleep deeper and much better that way. So side sleeping is the best posture to sleep in. A body pillow is the best to be used. If you can't sleep that way and you love to sleep on your belly, try to use a body pillow anyway and sort of almost lay on the pillow, maybe at a 45-degree angle, because that can convert you over from the low back curve being accentuated. When someone lays on their belly, one of the problems of belly sleeping is the curve dips down too far and you end up with pinching of your lower back. So if you can put a leg on the pillow, sleep at a 45-degree angle to the bed, you might get the satisfaction of feeling like you're belly sleeping, but at the same time, you're in a position that doesn't let the back curve too much and stay locked up. Something about sleep as well is we should be moving at night. I've said before that you can drown a shark by holding it still underwater. So it has to move to breathe. And movement and oxygenation are found throughout nature. It's a common theme in nature that we move and breathe. And the movement is part of the circulation of different fluids or gases in our body. Life is motion. And when we sleep, we should be able to be rocking back and forth, go to one side or the other. You can move too much, right, and be disruptive. And that's usually a sign there's some other issues, whether it's sleep apnea or so much joint pain and dysfunction and digestive issues that cause acid reflux and things like that as well. But make sure that you spend some time looking at getting yourself into neutral positions, knees slightly bent, hips slightly bent. If everything's slightly bent, it's kind of in the middle of your joint extremes. And that neutral middle is the best place for oxygen and to rest your joints properly. Let's see. Next one is walking good for lower back pain? Yes, if you can do it, right? I mean, if you have severe pain, you're limping around the house screaming, walking, I don't want people forcing it. Listen to your body to some degree. I want people to push their body, but listen to it. That's kind of the best. That's what I do. Anytime I have a problem with a certain part of my body, I still attempt to do the things I do. I might do them with less force, with less speed, and less often, but I try to say, okay, let's get this going again, there are times where things are so bad you need to wear a back brace and kind of just limp around, but I still want that back to have some motion in it. Like I've said before, if you can't run, walk. If you can't walk, crawl. If you can't crawl, roll around, right? Because any kind of motion like that's going to move by gravity the fluids in your body to nooks and crannies and oxygenate that tissue so it heals. We can't heal if we don't get our fluids, whether that be blood or lymph or the other fluids in the body, to the next place, right? The heart works part of it. The other part, the second heart in our body, is deep breathing, gravitational field variation, which is basically walking or running, or rolling around and crawling for that matter. All those will be the second pump. So we want to make sure that we're paying attention to that. So yes, walking is good. I usually have people. One of the tricks you can do is you go outside and you walk 3 houses to the left, then you come back towards the house and you walk 3 houses to the right. And then you're never too far away from the house if things don't go right, right? You don't want to be crawling 10 blocks. So, and don't be afraid to bring a cane or a stick or something with you. Try not to use it. But, if you have to put it down or something doesn't go right, you have that to get yourself back to the house. But motion is and walking is crucial. It is a pump to move circulation through your body. So 100% agree with that. Let's see. What organs cause lower back pain? Well, some of this is common sense, right? The organs that are close to it, right? So bladders, uterine tissue, ovaries, testicles they can shoot up. Kidney stones do. Now, kidney stones tend to be a little bit higher up than the low back. They're about 6 inches from belt line, somewhere around there. And you have one on each side, so it can, pick a side with a kidney stone or a kidney issue. But, you're running a fever and you have high lower back pain, think kidney infection, right? So think of the organs that are around there. But when everything feels great, except you got severe back pain, you can still consider all the organs in that area: stomach pain, prostate issues, anything that's an organ down there can refer to the back. Organs refer to strange, when I say refer, it means pain going to an area other than its source. Most people know that the heart tends to go into the left arm. In women, it has a higher likelihood than men to go into the right arm. We're all built a little differently. But we want to make sure that one of the ways is to move your body, and if it hurts to move, you're more likely it's the spine than your organs. And if it just hurts while you're sitting still and then elevates and comes down and you're not moving too much, hints more towards the organs as the problem, which is obviously serious and it needs investigation immediately. So let's see. So is bed rest good for back pain? That is pretty much a no. We want to quality sleep to heal. That's important. But do we want to lay in bed and hope back pain goes away? No. Once again, it's about circulation. It's about movement, right? We want to be able to get the fluids through our body, and laying still in a bed really doesn't do that. It just prolongs the condition. Our body will usually heal from lower back pain. One of the things they call low back pain is self-limiting, meaning it takes care of itself. Well, when we did studies on chiropractic care, massage, stretches, physical therapy, combinations of all those, and doing nothing but laying in bed, the people laying in bed were in bed a very long time. When they got out, they had episodes of back pain for the next series of months. They did worse, right? Because the muscles atrophied, the body stuck together, adhered, healed in ways that did not support motion. If you think about when the body heals, it's layers of onion skins in there, right? Layers of plywood. You've got fascia and ligament and tendon and different muscles and omentums, all sorts of tissues in there that have to slide past each other to allow us to move. So if you're laying still and this is injured, it's going to cement together, and then you go to move, it's going to bind, pull, and you're going to not be able to move as far, or you're going to have to tear through this, which of course is painful. So if while it's healing, you get it moving back and forth, all these layers in our spine, then the ones that don't belong together don't stick together. You know, imagine if you had a wheel and you're turning it and the ball bearings and you dripped glue inside the ball bearings, but you kept riding that bike. You know, the glue's not going to do much. It'll harden to each ball bearing, but it won't stick the ball bearings together. Leave it sit, what happens, right? All the ball bearings stick together and you can't turn the pedals, right? So moving parts need to move as they dry up in a sense and or heal. You want that tissue to stick together in ways that allows the movements to be restored and be able to work properly, you know, to do all the stuff. So no, I don't like bed rest at all for back pain. You know, to be specific, if someone's in severe pain, do I tell them to lay around a fair amount? Yes, sitting is a tough one for back pain. I don't recommend sitting. So, you know, lay a little bit, but get up a lot, right? You just don't turn on Netflix and hope your back pain goes away. That is not, by research and by observation, not an effective strategy. There's much more effective ways of getting rid of your back pain than hoping for the best and doing nothing about it. Is heat good for low back pain? Well, most of the time, the answer to that is no. I'm a person who likes ice. Inflammation is part of the problem. There's some good chemistry in inflammation. Only recently, some studies have come out that inflammation is part of the healing process. It makes sense, right? If your body starts healing and it's swelling while it's healing, maybe swelling is natural, and we should respect that to some degree. I have more respect for swelling than I used to, like from an injury. But at the same time, I want occasionally to hyper circulate the area by freezing it, right? So, and the ice times go by thickness of body part. And if we have, you know, neurological conditions, diabetes, you got to be careful with icing, especially the lower extremity. I don't recommend icing people that have diabetic feet, right? Because diabetics tend to have poor circulation, and we don't want to you can get frostbitten very easily. So if you're a normal, healthy, average person and you got back pain, you want to ice it. Now, the caveat on that is when someone has chronic low-grade back pain. So they deal with, on a 1 to 10, their back pain's a 3 and a 4 and a 3 and a 4, and it's going on for years. And it's from arthritis or it's from post-surgically, like the surgeon did a great job, but he can only get it so much better because of what's going on in that back. Those type of situations, heat works better. We're able to heat the area to try and expand that fibrotic tissue because it's a low circulatory rate. As we get older, our blood vessels lose diameter and they thicken and harden. So blood can't get to the tissue and from the tissue as efficiently. So heat can expand that. So by expanding older tissue, severe arthritic tissue, heat can sometimes be an answer. And that's for chronic. If that same person, 85-year-old with severe arthritis, sprains their back, falls out of bed, lifts something heavy, then you want to use ice for a short time. And you know, the icing times vary according to the density and size of the body part and or the person. If the person's obese and they got a lot of muscle, well, you're gonna spend probably twice as much time icing that area of the body. So I'm more of a fan of ice by a lot than heat. And the study's been shown to do that. It's not even just my personal opinion, which it is, but it's also backed by about 30 years of pretty good research on all that kind of stuff. Let's see, what is best exercise for lower back pain? Well, exercise for lower back pain is great, especially when you have a situation where you know that this person is under condition. This person doesn't have the muscular ability to support their back properly. So when someone is really in that area where you say, okay, this person is pretty much in the couch potato zone, we're going to make sure that we're stabilizing that spine with a lot of good muscular activity. The best exercise I find for numerous reasons is stomach strength. Most people that have back pain have weaker stomach muscles than back muscles. I've had athletes come in, head to toe, solid muscle, but their back muscles are incredible and their stomach muscles are just plain good, but not incredible. So there's a mismatch. And that'll sometimes cause a curve in the back, an increased curve in the lumbar spine. So they're putting those vertebrae at an improper angle or an improper place. And when that happens, they don't operate, right? Two gears not meshing at the right angle, the gears don't connect properly. So we want that spine in the right place by muscular support, right? Because we said before, the bones are the primary stabilizer, ligaments are the secondary, the shrink wrap, and the third is the muscles. So I give people a lot of stomach strengthening exercise. I love planks. Not everybody can do planks. You can try them from your elbows and your knees if they bother you. But a plank is great because it builds endurance. And stomach muscle is meant to be an endurance muscle, and it's not meant to move you great distances. And in a plank, you're kind of holding a still contraction. Contractions like that will give you that stability up front, because the back and your back is supported by back muscles, of course, but it's also supported by the side muscles, like the oblique muscles around your waist, and as well as your stomach muscles in the front. So if all those are tonified properly and they carry good strength to them, you're going to do that. But we also want, I'm going to add to this, even though they're asking the exercise, is flexibility. And flexibility comes, my three favorite exercises for flexibility are the yoga spinal twist, hamstring stretches, and then quadricep stretches, so heel to butt stretches. So when you get the front and back of the legs flexible and you create some rotational stretches, the lumbar spine really seems to sit in a better place. And then you add to that stomach strength. And last but not least, depending on your abilities, getting the hamstrings strong is also important. A lot of people have quad dominance, so their thigh muscles, their quadriceps, are way stronger than their hamstrings. A lot of people do not use their hamstrings in their daily life, and they get weaker and weaker, and that changes the pelvic angles, which leads to back pain. So depending how far you want to go with this can be a whole nother podcast just on strengthening of the lower back using basic exercises. But stomach muscle strength, hamstring quad flexibility, and rotational flexibility in what's called the yoga spinal twist. Best way answering that one. Another great question: fastest home remedy for low back pain? Well, strength and flexibility. Okay, we talked about that. So we want people to immediately start stretching and strengthening their body. Water intake, crucial, right? Discs are water. They're water-based. They're shock absorbers that, with the right amount of water, have the ability to absorb shock properly. So in the neighborhood of 3 liters a day of water, depending on how horrifying your diet is, right? If you're eating a lot of processed foods, you're going to have issues with your ability to hydrate yourself. If you're eating more God's food, right, you're going to be eating fruits and vegetables, sprouts. You're going to have water-rich foods grown right out of the ground, the way Mother Nature intended them to be. So water and magnesium, we mentioned that earlier. Magnesium is a common deficiency. It can lead to muscle tension. And when a muscle is being overworked because it's trying to deal with a bunch of nasty vertebrae that aren't doing their job, you want to make sure that those muscles are nice and relaxed, right? So magnesium is the muscle relaxant. It can loosen the bowel, so be careful. You can have diarrhea. So proceed cautiously with that. Don't go on a camping trip like that. And make sure that you're able to dose it very lightly. The average adult, about 250 milligrams start off with, and up to 500 milligrams is the range at which it can cause muscle to sort of drop down. Okay. Also, deep breathing exercises. Breath is crucial, right? It's the only form of like therapy that is independently discovered by healing techniques from around the world that never communicated with each other. So you go to India, you go to Africa, you go to the Americas or China, and they each had their healing techniques and didn't communicate with each other, and they each discovered that breath was one of the major things you can do to change your health for the better. So when you're doing deep breathing exercises, the simplest one I can give you is in and out twice as long, 10 times in a row every hour. So in 4 seconds, out in 8, 10 times every single hour. That's a great way of expanding and contracting tissue. Your breath pumps your lymphatic fluid around, and that's part of the healing process, big part of your immune system. So you want to make sure that you're using that as well. Let's see. Last but not least here, why won't my low back pain go away? Well, when low back pain doesn't go away, the first thing I would have to ask that individual, if I would just randomly ask that by somebody that I didn't know, I would want to know, what have they done so far? Okay. Have they sought professional help? Has there been a surgery? I'd want to be able to see the person visually to make sure that they're not carrying excessive weight, because your frame is designed for the weight you were in high school. If you were the proper weight, let's assume that you were not obese in high school. That's the weight your frame was designed to keep. And since we live so long and we worship food, we end up with extra weight. And it's acceptable in this country to be 30 pounds overweight. from high school. I'm not saying that's healthy, right? It's not healthy, but that's acceptable. So if that's going on, that could be one of the problems that causes, especially if you're carrying that weight mainly in the stomach, it pushes the spine down and forward and puts those vertebrae at a disadvantage. So you want to make sure that, you're looking at the main factors of why your back pain won't go away. Is it something serious, like we addressed in the very first part? That's serious problems that cause back pain tend not to go away. They need treatment either immediately or as soon as possible. So I would want to know, is it serious? What is your body shape? What is your body mass index and all these kind of things? And what have you done so far, right? Have you done nothing, or have you been through everything? You've been everywhere. Most of the time when someone's been everywhere, and there isn't a lot of good reason for back pain. There's no disc herniation that's really active or problematic. The arthritis isn't too bad. The person's the right weight. And you just can't, you're like, what the heck is this about? A lot of times that's the emotional areas, right? And we try to lovingly confront patients with this so they'll do something. And it's not easy, but it is something that needs to be brought up. Issues like we mentioned earlier, sexual abuse issues, anger issues, being in a chronic emotional state, whatever it is. We're supposed to have variations in our emotions. We're human beings. We're supposed to be happy, then we have sad and depression, all these things, but they should roll through, and we should spend most of our time, relatively content. I've had a pretty good record of getting people to quit their jobs, and every time I've done it, the person went off and got a better job, sometimes better pay and better benefits. They were just stuck in fear that this is all I have. Like they say, the golden handcuffs is one of those things, right? Where you have a situation where you're getting paid, you have benefits, and everything's really great financially, but you hate Mondays, right? You're dragging yourself to work. Is it worth it? One of the great questions I heard one time was, the extra money you're making doing the job that's making you miserable, how are you spending that money, right? Is it worth it? Is it for a better car and a bigger house, but you're miserable? I don't think that's worth it, but you at least ask yourself that question and see what you come up with. Make sure that you are, you got to be a little daring sometimes. Life isn't just simple, right? It's going to be a little gutsy sometimes, and you got to step outside your comfort zone and move careers, because sometimes that's what it is. So when someone doesn't know why their back pain won't go away, I would say to go back to try to shorten that up for everybody. It's most likely an emotional issue. It doesn't have to be. You want to look at everything, but those are the sneaky ones, because a person can be, I'm happy, I'm not stressed. People get used to stress. They get used to a lower level of contentment. That can happen and you don't even know it, right? I mean, depression is interesting. Some people have just strong wills, and they're like, I'm not wimpy. I don't know if I'm depressed. I've asked many people that question, and if a person is burying anger, and anger being a primary emotion that affects the lower back, and that's buried, they can seem somewhat content, and they're not. They're having a lower subconscious kind of anger. And I think I try to bring that up to people, and sometimes they will, get a sense that this is what's going on in my body. I am burying some of my emotions. I need to get those out. I need to talk about them. Mental health in this country has got to be at an all-time low with what's going on. I can't imagine. I hear stories, and it's really been a horrifying year, as everyone knows. I don't need to fill that out for you. But hopefully now the healing starts, and we can get into really figuring out where's the dysfunction, and get honest and get to the truth and figure out what's going on. So, all right, guys. So I hope this helped. This is my review of lower back pain. Some of the, the three basic causes, the three different areas you want to look at is emotions, chemical, and physical causes, and realize that a lot of the emotional stuff is buried. Look at your body and, does it getting soft and stiff? Or what can you do about that? Basic things. I like a plant-based diet. I'm not a fanatic about it, but the more I read and the more evidence comes out, I really think that we are not eating anywhere near the amount of plants that we should be eating. For so many reasons, it's so good to focus on that. Increase those in your lives as much as you can, because they're water rich, they're nutrient dense, and they tend not to lead to inflammation. Because one of the chemical causes, as we said earlier, for lower back pain is inflammation from our diet, from foods that don't belong in it. You can't put diesel fuel in a gasoline engine and expect it to run right. and there's a lot of diesel fuel that we're ingesting, right? And we're gasoline engines, let's say. Okay, so all right, guys, thanks for tuning in, and don't make sure you subscribe to this and like it and throw some comments at me. I'm not afraid to answer your questions or take the criticisms. I can take it. So let's hear about it. We want to make this thing great for everybody, a big learning experience. And you guys have a great day, and get your back pain solved. Okay, thanks.